team, I want to emphasize the importance of maintaining strict hygiene practices in our clinic. This includes regular hand washing, wearing appropriate personal protective equipment, PPE, and disinfecting surfaces.
I agree, Dr. Mihira. Hand washing is crucial in preventing the spread of infections.
Absolutely. We should wash our hands frequently, especially before and after patient contact. Use soap and water and scrub for at least 20 seconds.
What about PPE? When should we wear gloves and masks?
We should wear gloves and masks when there is a risk of exposure to bodily fluids or airborne infections. It's also important to dispose of used PPE properly.
How often should we disinfect surfaces in the clinic?
We should clean and disinfect surfaces regularly, especially high-touch areas like doorknobs, countertops, and examination tables.
Dr. Mihira, are there any specific guidelines for cleaning medical equipment?
Yes, there are specific protocols for cleaning and disinfecting medical equipment. We should follow these guidelines to ensure that the equipment is safe for use.
MIHIRA, to help prevent blood clots in the deep veins, especially if you're less mobile for a while, there are some gentle steps we can take. Getting moving as soon as it's safe to do so, even just short walks or shifting in bed, really helps keep the circulation going. Staying well hydrated by drinking enough fluids is also important for healthy blood flow. Simple leg exercises, like wiggling your toes and ankles or making circles with your feet, can make a big difference too. Sometimes, the doctor might also recommend wearing compression stockings, which gently squeeze your legs to help blood travel back to your heart more effectively. These measures work together to encourage good circulation and reduce the risk of DVT in a kind and supportive way for your body.